morning, and thank you all for being here. I know that 9:45 in the morning isn't the easiest, especially after spending all night reading the disastrous Trump care bill that Senate Republicans dropped yesterday. Before I begin, I want to thank Congressman and Dr. Raul Ruiz, Chair of the Healthcare and Mental Health Task Force of the Congressional Hispanic Caucus, and Congresswoman Judy Chu, Chairwoman of the Congressional Asian Pacific American Caucus. And I want to thank Congressman Bobby Scott and Congressman Castro for being with us today. Yesterday, after weeks of secrecy and backroom meetings that I might add included no women, no Democrats, and no people of color, Senate Republicans have finally unveiled this bill. If you ask me, they should have kept it hidden. It's an embarrassment to them and an impending disaster for American families. Despite all their cloak and dagger tactics, they can't hide the fact that they are going to raise premiums, decrease what insurance covers, and strip millions of their health insurance, all to give the super rich a whopping $37,000 tax cut. As more than 20 million Americans lose their health care, just about 1% of Americans, many of whom serve in Congress, are going to get a nearly $40,000 tax cut. Republicans in Congress want to just give that away to those who already have the most. This entire bill is a complete and utter disaster that will impact American communities from Chicago to Bar Harbor, San Antonio to Anchorage. It will have a disproportionate impact on communities of color. We've come too far to go back now. When it comes to health equity, we need to keep moving forward, not backwards. Under the Affordable Care Act, more than half the number of African Americans were without Under the Affordable Care Act, we saw more than half the number of African Americans without insurance. We also more than half the excess death rates from cancer that black men experience. According to the American Cancer Society, this progress is directly linked to the increase in health care access brought about by the ACA. Tragically, Republicans are working overtime to undo that progress. Instead of making advances in health care and health outcomes, they want to send us back to the days when families went bankrupt trying to pay medical bills. Or worse, back to the days where people didn't see a doctor because it was too expensive and died from a preventable and/or treatable disease. Just 2 days ago, I joined my female colleagues and members of the press corps to raise money for breast cancer at the congressional softball game. For me and the Black Caucus, ending breast cancer is a major priority because black women have a 40% higher risk of dying from it than our white sisters. But regardless of your race, breast cancer is nearly 100% curable if it's caught in stages 0 or 1. Yet, they are taking away people's health insurance and funding to Planned Parenthood. This means that more women, and even more black women, will needlessly die from breast cancer. If you want to stand up to cancer, you must stand up and say no to Trump care. All the softball games in the world aren't going to save the lives that just having health insurance, testing, treatment, and access to Planned Parenthood will save. And the American people will know that. It's clear that the American people aren't buying what President Trump and Republicans are selling. A recent NBC Wall Street Journal poll found that just 16% of Americans think Trump care is a good idea. That's beyond a failing grade. The other 84% know that Trump care means that they will pay higher premiums for worse care if they can afford insurance at all. It's time to recycle the paper that both the House and Senate Trump care bills are written on and come together as Congress, not Republicans and Democrats, but the elected representatives of the American people, and make health care affordable for all. Now I'd like to turn it over to Congressman and Dr. Raul Ruiz.
Thank you. Good morning. I want to recognize Congresswoman Robin Kelly, Congresswoman Judy Chu, and Congressman Bobby Scott and Congressman Joaquin Castro for their unwavering support and fight for this cause. Yesterday, I stood with over 100 physicians, ER doctors, surgeons, OBGYNs, primary care physicians. They came to Washington from all over the country to highlight the devastating impact Trump care would have on patients. Not too long ago, one of our colleagues in the House, Republican colleagues, said, quote, "Nobody dies because they don't have access to health care," unquote. Physicians like me know firsthand that that statement is false, because physicians like me have seen people die because they didn't have access to health care. When people can't afford primary or preventative care that could catch treatable cancers early, or can't afford their medications for serious chronic illnesses like diabetes or congestive heart failure, they die. I treated, for example, a 55-year-old uninsured woman who came into my emergency room with vaginal bleeding. We stopped the bleeding and diagnosed her, unfortunately, with advanced cervical cancer. She didn't have health insurance and she didn't have access to care, so she had never had a regular pap smear that could have detected the cancer early. 6 months later, despite chemotherapy, her cancer was too advanced and she died. Make no mistake, Trump care means millions more will be uninsured without access to care, causing thousands to die. That's not a political statement. That's a medical fact. I know because I have seen it. Trump care isn't just quote unquote mean, it's cruel and deadly. Every patient I see in the emergency department asks me two questions. Doc, am I going to be okay? And Doc, how much is this going to cost me? The answer to the second question always comes back to one fundamental thing: healthcare coverage that saves lives. And that's what's at stake in this debate. The millions of people who are at risk of losing their health insurance and essential health coverage. As a doctor, I took an oath to do no harm. And I urge all representatives, all senators, everybody in the administration to take that same oath to do no harm. Instead of ripping health coverage from millions of Americans and doing real harm, let's work together to continue improving health care for everyone. Thank you. And at this point, I would like to turn the time to Congresswoman Judy Chu, Chair of the Congressional Asian and Pacific American Caucus.
Thank you, Congressmember Raul Ruiz, and I thank Congressmember Robin Kelly for putting this together, and also Congressmembers Bobby Scott and Joaquin Castro for being here to join together and making a statement about the Senate Republican health bill. They finally revealed their plans to the American people yesterday, and it's no wonder they didn't want to hold any hearings, markups, or even open this bill up for debate or any comment, because it's just as mean as the House bill. The Senate's version of Trump care is yet another example of a massive tax cut for the wealthy, paid for by cutting health care for ordinary Americans. And while we await a CBO score, we know that by rolling back the Medicaid expansion, this bill will leave millions of people without health insurance. It's also less generous in terms of tax credits, so the people who have the most to lose will be the ones to see their costs skyrocket. Whether it's 10 million or 23 million, we cannot fix our healthcare system by forcing people to lose health coverage. As chair of the Congressional Asian Pacific American Caucus, I am disturbed by the ways in which Trump care will harm everybody, and Asian Pacific Islanders are amongst them. First of all, the ACA has done so much for Asian Pacific Islanders. The uninsured rate for AAPIs have been cut nearly in half since the passage of the law. And health centers that serve predominantly AAPI patients have been able to thrive. But this bill will cut Medicaid even further, and these centers will be hard hit. And nearly 2 million AAPIs are at risk of losing critical healthcare coverage under Trump care. That means fewer resources to those who help get sick. Our community cannot afford to go backwards. And this bill does even worse things to immigrants than the House version of the bill. It is a way of targeting immigrants who are in this country legally. Let me say this again. This bill would prevent legal immigrants from obtaining subsidies to help pay for health care coverage. Under current law, lawfully present immigrants are required to purchase health insurance and are eligible for subsidies to help pay for their coverage. Lawfully present immigrants are a broad category of those who are here on student or work visas, but also those who, of course, are those with green cards, but those awaiting to get green cards, which can take years. But the Senate bill is even stricter. It restricts the number of immigrants who can get the health credits, saying that tax credits can only be for qualified aliens. And so those who already have a green card, that is only those who have the green card or who qualify for special residency status like refugees or asylum seekers, are those who consider qualified, a smaller subset of those immigrants who are here. With this small change in language, the Senate bill excludes legal immigrants who work here and study here and are legally able to afford health care. So this bill goes after everyone. Immigrants, AAPIs, so many people of color, and it creates an age tax and lets insurance companies target older Americans 5 times more for the coverage than young people. And it allows states to roll back the essential health benefits that cover such essential things like hospitalization, prescription drugs, and maternity care, emergency services, or mental health services. So if you eliminate all of that, what is left? Terrible coverage, and in fact, worthless coverage. So I call on my Senate colleagues to oppose this destructive bill for the harmful impact it will have on all Americans. Thank you. And now, I would like to introduce my colleague, who is the ranking member of the Education and Workforce Committee, and also the Civil Rights Chair of our KPAC task force, and that is Congressmember Bobby Scott.
Thank you. And as ranking member of the Committee on Education and Workforce, I'm one of the members leading the Democratic Caucus in terms of healthcare policy. I want to thank our colleagues for their comments, and just to add a couple of points. One, I think it's important to note the nature of the debate, and it's debating fraudulent technique that's being used to try to promote these new bills. The fraudulent technique is, first, we have a bill. If you don't like the status quo, therefore you have to support the bill, without any discussion on how the bill actually improves anything. And every time they get asked about what's in the bill, we have to do something. Well, if the something is worse than what you have, that's not a good idea. And so they have to be called on exactly who benefits. We know the costs will go up, we know the policies will be worse, and we know fewer people are going to be insured if either the House or the Senate bill pass. And so we should not let those who are promoting these bills get away with just saying, if there are problems with health care generally, therefore we have to do something and promote a bill, either one of the bills. There's a fundamental fact of arithmetic. If you have massive tax cuts, take money off the table, you will insure fewer people. You will have fewer support for those that can get insurance. And also, they have in the Senate plan no mandates. We know that if you allow people to wait until they get sick before they buy insurance, they will wait until they get sick before they buy insurance. Every time this is tried, the program collapses. In Washington State, it took them 3 years to the point where nobody could buy insurance. New York, when the Affordable Care Act came in and the individual market, the premiums went down more than 50%. And so we know that if you have no mandates, you really don't have a plan. And finally, where there are difficulties in finding insurance, according to the CBO report just a few weeks ago on the House plan, it said that the market was stable. If there are problems getting insurance, it is because the Republican administration has sabotaged the Affordable Care Act. That is, they have questioned the mandates, they have questioned the insurance payments, and with the uncertainty, insurance companies have decided in some areas to back out. When one company came out of Virginia, they pointed to the uncertainty in the enforcement of the law as the reason they were pulling out of Virginia. And so you can't sabotage the plan and then complain that insurance companies aren't going to be there. Robin.
We'll take questions now if you have any. No. Thank you.
Thank you.